Our overall goal is to improve the levels of social connectedness experienced by marginalized families who have children from birth to age 5. We're doing that through a 3-track focus. One track is primarily the work that we're doing with neighborhood leaders within their neighborhoods, identifying issues that they see of importance that can have an impact on the health of the young families. And then our second track is looking mostly at systems change and thinking about how can we adapt the system to meet the changing needs of these young families. And then our third track is community education and thinking about if we want the residents of the neighborhoods that we're targeting to be able to improve their lives, the rest of the community has to be on board too. In 2007, we had a planning grant. That was the first phase of our project. And in that process, we conducted a series of focus groups and asked them what the issues were around raising their children in a healthy way. And one of the things that we heard over and over again was this sense that they knew the services existed somewhere, but they didn't know how to get to them. They didn't know how to access. And it became clear that once somebody is in the loop, then they have access to all of these other programs and services. But figuring out how to get in that loop is really complicated. And when you add on top of already existing factors like socioeconomic status, but you add on top of that somebody who doesn't speak English as their first language, or somebody who's got other sorts of barriers, like they don't have access to transportation, they don't have access to the internet, it's nearly impossible to find out some of this information. And yet our service providers as partners heard this information and said, we bombard the community with information. How can they not know? And it has to do with the fact that they're bombarding the same people over and over, and then there's this subset of families that we refer to as marginalized who aren't a part of that target audience and need to be.